What if I told you one of the most dangerous assumptions a nursing student can make is this? The medication name looks familiar, so I must know what it does. And the NCLEX knows that students think this way. So today I'm going to talk about look-alike and sound-alike medications and why they are some of the most common NCLEX pharmacology traps. If you've ever mixed up medication names or second guessed yourself on an exam, this lesson may be for you. Now, what are look-alike, sound-alike medications, right? Look-alike, sound-alike medications, often abbreviated as LASA, are medications that have similar names, spellings, or pronunciation, but very different purposes and effects. These medications are typically the leading cause of medication errors in real clinical practice. So, you have to remember the NCLEX is designed to test real world nursing safety, not trivia, okay? Real world nursing safety. So, when nurses confuse these medications, they can actually harm patients fairly quickly, which is exactly why the NCLEX test them. So the NCLEX doesn't expect you to memorize, like I've said before, endless, medication lists. They're not looking for that. What the NCLEX expects is that you slow down and you verify when something looks or sounds familiar. So the trap kind of works like this. You recognize part of the medication name, and then you assume its purpose. Then you answer too quickly, and then you miss that safety issue. And the NCLEX rewards nurses who kind of pause and kind of step back and say, "What's going on?" Not nurses who rush. Okay, remember that. So why are these errors so dangerous? Okay, look-alike, sound-alike drugs are dangerous because the medications often act on different body systems. One medication might lower the blood pressure, but the other might treat anxiety. It may cause sedation. It may even affect the heart rate. So if you confuse them, you might treat the wrong problem and then create a new one or create a new one. So, you know, I'm going to go over some commonly taught medications that students, like you may actually see, but sound alike, or may look alike. All righty. So the first one here is hydralazine versus hydroxyzine. Now, hydralazine is an antihypertensive and it lowers the blood pressure. Hydroxyzine, though, is an antihistamine and is used for anxiety, itching, and nausea. So, what happens sometimes with students is that they'll see Hydra and then assume it's the anxiety medication. And why is this dangerous? Because if hydralazine, which is an antihypertensive, is given when the patient is already hypotensive, it can severely drop the blood pressure, causing dizziness, syncope, or shock. All right. So the NCLEX wants you to think, does this medication treat the patient's actual problem or does it make it worse? All right. A second one would be metoprolol versus uh, metoclopramide. Now, metoprolol is a beta blocker. It lowers blood pressure and it lowers heart rate. Metoclopramide is a GI medication. It increases gastric motility and it treats nausea. So, what's the problem? If students look at the beginning and see metro and they choose based on familiarity instead of its actual function, it's dangerous because if you give metoprolol to a patient that already has bradycardia, it can worsen it. It can cause hypotension. It can cause heart block. So the NCLEX wants you to think which one of these medications actually match the patient's priority problem that's existing right now. Another one is morphine and hydromorphone. Alrighty. So if you don't know, hydromorphone is actually Dilaudid. Both are opioids. However, hydromorphone is much more potent. So the trap here is that, the student to think, well, they're both pain medications. It doesn't matter, right? Well, it actually does. Hydromorphone has a much higher risk of respiratory depression, especially in opioid naive patients. So the NCLEX wants you to realize that potency actually matters. and respiratory rate and level of consciousness must be assessed before administering these types of medicines. And the last one we're going to look at is clonidine versus um, clonazepam. Now, clonidine lowers blood pressure and is used for hypertension. Clonazepam is a benzodiazepine, which is used for anxiety and seizures. So these names are similar, but as you know, as we stated with other examples, the effects are completely different. And so, why is this dangerous? If you give clonidine when the blood pressure is already low, it can cause hypotension and it can decrease perfusion. So the NCLEX wants you to think, what system does this medication actually affect first? And is the system already compromised? So, anytime you see a medication name that feels similar but not quite right, please pause and ask yourself, what is the medication actually used for? What body system does it actually affect? And what is the worst possible outcome if I confuse this medicine? Because if you can't confidently answer those questions, the safest action is to verify the medication and make sure that you're giving the correct one. So let's look at some scenarios real quick. A patient with anxiety has an order for hydralazine. Now, the problem here is hydralazine does not treat anxiety. So, the safest thing that you can do is clarify the order before you administer the medicine. Number two, a patient has a heart rate of 54 and has an order for metoprolol. Well, the problem now is that the patient has bradycardia. So, you want to hold the medication and notify the provider. And the third scenario, you have a patient that's opioid naive and they have an order for hydromorphone. All right. So the problem here is that hydromorphone is a potent opioid, and that's going to put that person in increased risk of respiratory depression. So what you want to do, the safest thing, is to assess the patient's respiratory rate and level of consciousness before you administer this drug. And so why students miss these look-alike, sound-alike questions? Well, a lot of times they read too fast. They rely on name recognition. They may skip an assessment, or during the NCLEX, you may feel pressured by time, or even in actual clinical practice. But understand when you take the NCLEX, it doesn't award speed; it awards safe decision making. Okay, and so that's it. Look-alike and sound-alike medications are not trick questions. Okay, don't think they're trick questions because they're not. They're safety questions. The biggest thing with the NCLEX and in actual clinical practice is safety. And so please remember that. And download the Pharmacology Safety Mini Workbook at NurseEdScholar.com to practice medication safety scenarios like we did today with rationales. Also, please subscribe so you don't miss Lesson 4, Dangerous Adverse Effects You Must Catch Early. Alrighty. So please continue to study and so you can learn how to test like a pro. And thank you for watching Nurse Ed Scholar.